My warmest greetings to all my viewers. It's a special moment, I think. Colonel Charan is with me. He's a retired army officer. Manpreet, his daughter. You see, he's had a very, very major surgery 2 days back, and he's sitting in my office. He's had a what we call a commando operation. 2 days back, we've opened his entire neck, and we've removed his jaw, and everything has been put back, and you can't really make out that he's had such a major surgery. So I would leave it to Colonel Charan and to Manpreet to ask any questions. Basically, the podcast is meant to be educative. So whatever questions you have, the listeners also would have the same questions. So let's give an answer one by one.
I just want to know what is this commando operation.
Oh my God, commando word.
Everybody
Yeah.
seems to be talking about
It's
this.
considered to be like it's the word has been taken from the commando operations of the army
Okay.
because it's supposed to be a devastating operation in the army. Similarly, it's a devastating operation. We remove most of the things out of your neck and face. We remove all the lymph nodes, the muscles, the glands, the jaw. Devastating operation. And then equally big is reconstruction. So we put you back in shape so that you can speak normally, you can eat and drink normally, you can look normal, and you can lead a normal life. So the commando bit is the devastating operation, and thereafter we have put you back in shape. Absolutely. It takes us hours and hours, but finally, in 2 days' time, you're sitting with us. So, let me ask you, when did you have the least of problems in your oral cavity? What problem do you have and when did you have? Can you recall?
I've basically been having some sort of bleeding
Oh, from your gums.
from this particular area,
Yes.
and I used to take
It's
it.
been about a year?
No, maybe more.
6 months, more than that. My God. It's been about 2 years.
Maybe even more than that, because my pillows, they used to keep getting this mark, but then it would stop.
Oh, well.
So I never
So
took
it's
it
a
very
very
seriously.
important sign that you are having bleeding in your mouth for 2 to 3 years, and you must have gone to doctors, or never.
No,
No,
no.
you must have.
So when I went for my implants,
No, why did you think of implants much later? But you first must have asked people, why is it bleeding?
no, implant also I got it about 3-4 years back.
Okay.
That's the time I realized. First I got the complete upper set.
Okay.
Lower set was as it is. There was a bridge here, but no implants. Now, 8 months back, I had gone for my
Lower implants.
lower implants.
Well, I tell you, sometimes our focus is on something and we overlook what is brewing inside.
Yeah.
Your focus was on implants.
Yeah.
And you thought the teeth are bleeding because they're not healthy. So neither did you think, nor did the doctor whom you went to think, why is it bleeding? And so neither can I blame you for it, nor can I blame perhaps your dentist for it, because after all, these are specialized, issues. And suppose you had gone to an oncosurgeon, to a cancer surgeon, or a head neck surgeon, he would never have missed it. In the first sight, 3 years back only, he would have told you it's a cancer. Sometimes people come to me with ulcer in the mouth. A biopsy has been taken, not once but twice in the last, let's say, 1 year's time. And they say the biopsy has been done and all is okay. But I tell them, let the biopsy do anything, be anything. It is frankly a cancer. Because it is our experience which tells us this is a cancer, whatever be the biopsy. So you had a cancer growing in your lower gums of this side, left side, for the last 2-3 years. And in spite of that, you continued with your implants. And when you came to me, you had implants all over, but a frankly, obviously looking cancer of your lower jaw.
Yeah.
We call it lower gingiva, gums. So all this side of the left jaw was involved with cancer.
So, Dr. Dharma, what symptoms should people take care of?
Obvious, one
for
of
when-
them is a bleeding from your gums. Second is an obvious wound, which we call ulcer, or a swelling, or a tooth which is loose. They all can be signs of oral cancer. Oral cancer has many parts, beginning from lips to the junction between palate and soft palate, or the whole of the tongue, the floor of the mouth, the buccal mucosa as we call it. The skin inside is called buccal mucosa. So all these are parts, or the lower gingiva, the upper gingiva, the gums we call gingiva. So he had the cancer of the gingiva. All these parts, they behave differently and they have different signs. But generally, the symptom is a ulcer or a bleeding or a growth or a swelling. So these are the signs. But you had this, and you somehow you did go to a doctor also, but unfortunately it was missed.
And now is actually, when you carry out this operation, this surgery, what all did it involve?
What all did it involve? It involved your lower gingiva, left side. We may call it lower jaw, or we may call it lower gums of the left side. And they had gone into the bone. So what we did was, we removed your half the mandible, we call it, half the jaw. We removed it. The full jaw is from here to here, so we removed it one side. Now, when we removed the whole thing, and we also removed all your lymph nodes from the neck, along with the muscle
Because they are automatically infected.
they, as a protocol, they have to be removed. If we don't remove them, we have no way to say that they are not involved. Whereas in most of the cancer centers, we have a facility to do a frozen section, what we call it. That means a histopathology which is done on table. So we've got that done, and they were positive. Their nodes were involved. So the nodes were involved. We've already got them checked. So when the nodes are involved, then we don't do a limited dissection. Then we do a comprehensive dissection. Comprehensive means all the 5 odd groups of lymph nodes. So were removed. In your case, even the prefacial nodes were involved. I mean, once we removed them, we sent them. Normally, prefacials are not involved, but we removed them. And, removing them is a little more taxing, because that can affect your smile. So you must have seen even some celebrities have had this surgery. Their face is bent, is twisted, but your face is absolutely normal. I take a lot of care to preserve your smile. Your smile is absolutely normal.
His smile is normal.
Absolutely
That much
normal.
I can tell you.
I take a lot of care to preserve that nerve, which is the nerve to the smile. It's called a marginal mandibular nerve. So that was saved. Prefacial nodes were removed, sent for frozen section. They came out to be positive. So then we did a comprehensive neck dissection. So, and then the issues in your case was that the implants had been fitted. So for us to be able to, cut through the implants was a little demanding, tricky job. So, your dentist helped us by at least cutting through the bridge. So he had cut through the bridge on the previous day, and then we wanted to preserve your chin. So you see, your chin has been preserved, but higher up, your whole jaw is gone. But just the chin has been preserved. Higher up, we've removed, because the first, what is called incisor, was also involved. This tooth was also involved. So we cut your mandible like that and removed your jaw. And now we had 3 options of reconstruction, which we discussed with you.
Yeah.
And I don't know, you were very, you were not at all confused. You took the decision right away. I gave you 3 options. One is that since it's only the jaw which is to be removed, so we have a buccal mucosa and we have the floor mouth. We can close them, and you will look normal. Second option is, we can bring in muscle from here or from the leg, either microvascular or an axial, what we call it. So we can reconstruct the soft tissue. Or the third option is we can bring in a bone, which is the commonest thing is a fibula, a bone from your leg, and reconstruct your jaw. The bone can be provided back. But you were very clear that I want a quick recovery and I'm not so much concerned about cosmesis. And I want quick recovery and I want quick function. Be able to swallow, speak. I don't want any tracheostomies. I don't want to be on nasogastric tube. I would want to be able to drink the same day. Well, it's possible. So you see, from the day one, you've been drinking liquids. We've hardly had any nasogastric tube for you. No tracheostomy, nothing. You were up and about from the day one. We could have sat together. You actually visited my OPD yesterday also, and day before was your surgery. So we've done a primary reconstruction for you, a primary closure for you. We have not put any muscle. We have not brought in any bone. But if you look at anybody looks at you, it's the second post-operative day. Your face is absolutely normal. No cosmesis could have been better than this in the entire world. Let me assure you that. I've been doing this surgery for 40 years, and we have all the three options. Had you told me bone to reconstruct करना ही पड़ेगा, yeah, we would have said yes, करेंगे, ज़रूर करेंगे. It all depends upon what you like it, what you would want. You tell me, how did you think of this, that I would want a primary reconstruction?
I was convinced for a very fat early recovery.
Very good. Very good.
And since I spoke to the person whom we had operated on earlier,
Oh, yes.
Yeah.
Sushil.
Sushil.
You talked to Sushil.
Yeah, so-
Sushil also had the same. But still, the best thing I advise people is that you choose your surgeon. In fact, I've been advising people for the last 30 years, even when the army. Although army, when you are the boss, the army clientele doesn't have many options. They have to come to you only. But I would tell them, go anywhere. I would facilitate your treatment anywhere. You select your surgeon and then leave it all to him. Because it's not that always the best option is to do a primary closure. No. There are times when we have to put in a fibula. There are times when we have to use a ALT, or there are times when PMMC is the best. So these things are better left to the surgeon rather than dictating the surgeon that this is what I would want.
I think that's what we did in the end. It was
I
a
think you did
discussion.
that.
After discussion, we decided.
You told me
We took all
whatever
the-
is the best for me, do it. And I would want a quick recovery. I would want that I should be able to be functional as soon as possible. So any other questions?
What's the recovery path now?
हो गया ना recovery? Tell me what recovery path is required. He is fine. We can discharge him tomorrow. We could have discharged him home today also, but you should be satisfied. Whenever you think confident, we'll let you go home. And thereafter, what is recovery? He's already recovered. In a week, 10 days time, we'll allow him to eat anything. Presently, we'll permit him to drink anything, liquids. And a week, 10 days time, we'll allow him to eat anything. You are able to chew right now also. Your jaw movements are normal. Open your jaw and close, yes. Your jaw movements are fine, you can chew normally. Even the surgeons don't know that how would one jaw close on each other when one jaw is not there. It will bend. It requires just 4 hours training on the first day, which told him once or twice on the day when he came out of anesthesia that you should allow your jaw to clench. And he's been trained.
He's been doing that. I think he's been doing that.
Yes. So now your questions can be any radiation required or not. You see, it all depends upon the stage. And the stage we'll come to know only from the final histopathology report.
And then the path.
That'll take about a week's time from the surgery.
Okay.
So that'll tell us what stage it comes out to be. If the lymph nodes are involved, he definitely requires radiation. If the lymph nodes are, what we call extranodal extension, ENE, then he requires chemo as well as radiation. As a surgery, as a surgical oncology, our goal was to remove all the nodes and to remove the jaw with adequate negative margins, which we have done. So we've done a complete surgery for him. We've given him an excellent reconstruction. And now it all depends, radiation or chemo would be required, not depending upon the stage. Okay. So anything else? Sir? You're happy
I'm more than happy.
with all the decisions, and I think you've not had any pain really. It's remarkable that such an extensive surgery, which we call Commando operation, you never came to know of it. So God is kind. I mean, we can't take all the credit, and in fact, any credit upon ourselves. It is all His mercy, His grace.
Thank you so much.
Manpreet, anything?
In fact, we would like to thank the entire team for taking care of us from the time we walked in,
Yes.
with all our apprehensions, with all our worries, and with all our fears, till the day I think we'll get discharged, because we've really been taken care of. So thank you so much.
And you see, along with you, I also as much thank Fortis Hospital for providing me all the necessary equipment and the infrastructure and the post-op care, which cannot be possible in small setup. Is not possible.
Thank you.
Thank you so much.
Thank you.